We kick off our event with a conversation on healthcare's sustainable future, balancing technology, environment, and workforce. Shahid Shah is an internationally recognized healthcare IT thought leader and publisher of Netspective Media, where he promotes transparent, peer-reviewed innovation in digital health and medtech. He also chairs Health Impact, using his expertise to accelerate healthcare transformation through strategic conversations and industry collaboration. Shahid will be talking with Dr. Merage Ghane, who serves as Director of Responsible AI at the Coalition for Health, and where she leads Health AI, where she leads the development of guidelines, best practices, and practical tools to ensure responsible AI in healthcare by bringing together clinicians, technologists, policymakers, and patient advocates. So I'm going to stop sharing my screen and I'm going to welcome Shahid and Dr. Ghane, and I'm going to turn it over to you.
Awesome. Well, welcome everyone to our 4 hour long, but it will run past very, very quickly because you guys have got a big treat for you. We've got lots and lots of great speakers. All of this is being recorded, so if you miss anything, ask your questions. We'll get them answered here. And then, of course, all of this will be available later on YouTube over the coming weeks as well. But it's such a great pleasure to have Dr. Ghane here. And Merage, I'll just call you by your first name just to keep it a little casual for our little fireside chat here. But you're at Chai, and lots of people have heard of Chai, but just in case somebody hasn't, tell us a little bit about what Chai is and what you do there.
Yeah, happy to. So, CHAI, or the Coalition for Health AI, I know there are a lot of organizations that have the CHAI acronym, so be specific. We are a member-driven nonprofit, a multi-stakeholder initiative. We bring together sort of leading health systems, smaller health systems, sort of FQHC communities and networks, technology developers, payers, the whole sort of gamut of healthcare, with the goal of sort of de-siloing some of these conversations and really driving the development of industry-led best practices. So at our core, we want to advance safe, effective, and fair use of AI in healthcare. And we focus on creating practical tools. We have responsible AI guides, frameworks, but also we're moving into developing more best practice guidance, testing and evaluation methods, metrics, and guides, and playbooks that sort of build on that, as well as other tools that I'm happy to talk about as we kind of go through the conversation. And we really want responsible AI to be possible for all. So we work we kind of started from the academic medical center space, but we have since shifted and really want to make sure that we can capture that entire landscape, especially some of the smaller organizations that maybe are less resourced to be able to adopt responsibly and at scale.
No, that sounds fantastic. And I definitely love the mission. Absolutely necessary for everyone to become part of this organization in some way, because there won't be any parts of healthcare that are not going to be touched by AI over the next at least half a decade, if not sooner. So as we start this conversation in the IT world, most of what hospitals use is run by EHR vendors. It's run by large cloud vendors like the Microsoft and AWSs of the world. How are you guys integrating with these vendors? Are they coming to you? Are you going to them? How are we making sure that Chai is integrating with those vendors who are actually providing the technologies that your playbooks are hoping to influence?
Yeah, so I think it's a little bit of a mix of both. We've had folks who have come to us. We have folks that we've reached out to. But I think, we're hoping that it's not just the vendors that are getting on board, that we can sort of create synergy between the vendors and the adopters to really create shared dialogue and space for shared dialogue across the work that we're doing. So if there's no demand, there's not going to be a service. And so how can we create that synergistic sort of demand from the healthcare systems that are adopting these solutions, and the sort of pressure is not the right word, but gentle prodding to make sure that responsible AI is also integrated there. So, how do you have the conversations with your vendors about what you need to make an informed decision? How can you co-develop with vendors for solutions that maybe are a little bit more niche, just having those conversations more broadly. So I think that's sort of been our perspective there. We also are encouraging folks to use things like model cards for transparency, sort of from vendors, requesting those. And the model card we've developed aligns with HTI1 requirements, which applies to EHR vendors and solutions that are put there. So keeping things sort of consistent, whether your vendor is an EHR provider or an EHR vendor, or if it's like an independent sort of startup that's creating these solutions.
In fact, I love that strategy because as you look at adoption, I think there's the question of adoption for AI has long been answered now. The answer is going to be yes. The question is at what levels? And so I love that idea of everybody focusing on the demand side. And on the demand side, basically, if you are talking to IT vendors, whether it's an EHR vendor or a practice management vendor or anybody else, I think the practice should be, what are you guys doing to align with the model cards? What are you doing to align with the playbooks that Chai is giving out? And I think that's why I really brought it up, is I wanted people to not wait and say, oh, well, they'll just handle it, so I don't have to worry about it. No, you have to worry about it, because as the adopter, everything is still your responsibility to go forward and make sure that you're doing in a way that you can actually execute and use in your environment. So I think that's a fantastic place to start. And related to that question, on LinkedIn, we were having a nice chat on LinkedIn, and a audience member, Fahim Kareem, asked the question, what are practical steps forward for health systems with entrenched legacy platforms? How do they modernize incrementally while still positioning themselves to benefit from AI innovation? Now, this is a really, really hard question to answer. I'd love to toss it to you, see what you're hearing from the community about all this legacy system and how you integrate it. And then I'll put in a few thoughts as well.
Yeah, I mean, I think one of the things when we develop best practices for the best practices that we develop are not just for the health system deployers, but also for the developers. And so a lot of that conversation is like, hey, if you want your product to be adopted, you want it to be interoperable, you want it to at some point be able to integrate with these systems. And it's helpful to have things like FHIR standards, and they're sort of increasing and improving as we go. So maybe starting there, but I think there are also standalone AI solutions that could integrate when you update your EHR to not the legacy system, or whatever other system is sort of there, that it could integrate, but maybe can also function on a standalone basis, doesn't disrupt the workflow immensely. And getting started at that level, something low risk, I think that's maybe a good sort of starting point. And I think this is part of the importance of governance, and I think this topic is going to come up a lot, but part of governance isn't just having it in this small, just like in your IT department or in your data, management process, or it really should be something that executives at higher levels have a strong understanding of, like, why is governance important? Because part of that is we need infrastructure to support this initiative. And we want AI to align with our organization's initiatives and mission, not just like AI for AI's sake. And so that's where some of these shifts at maybe a faster pace might start coming about, is when you have that buy-in at the executive level.
Nice. And there's a quick question that I'll pose to you from Abigail. But right before we get to Abigail's question, this idea of not knowing what to do with legacy systems is, of course, rampant across even non-healthcare as well as healthcare. So the best way to answer that is start to build out your prompts, and so use AI to help you answer this particular question. You and your IT team should have a stacked, ranked list of the most important assets that you own. Some of them are applications, some of them are servers, etc. As you stack rank those, you start to build out the prompts. And if it's helpful, email us at Health Impact and other members here. I can send you exact prompts that you can put in to help you answer this question about the legacy systems. But with that, let me bring up the question from Abigail. She's asking, how are you engaging? She's asking with Chai, how are you engaging with smaller provider orgs to get them engaged with Chai? What is the adoption at that smaller provider level so far?
Yeah, this varies widely, but in terms of how we're engaging, I mean, in this exact moment, I'm in West Virginia at their Primary Care Association conference, giving a talk to sort of introduce them to some of the things that Chai offers, and also talk them through sort of like what are the basics of governance if you want to start this process, what is sort of the bare minimum you need to do. So that's some part of what we're doing. We also have partnered with the National Association for Community Health Centers, and we're really driving several initiatives there, making sure that our governance playbooks that we are going to be putting out over the next couple quarters, that those include perspectives from some of these smaller provider organizations, and especially not just smaller, but less resourced provider organizations. And we're including those voices in our workshops as well. So we had some governance workshops. I think the last one is actually tomorrow. So to get folks' thoughts on like what are the must-haves and the nice-to-haves when it comes to governance, and really start building the sort of foundation from the ground up. And offering examples of how different folks are doing this. In terms of where folks are at, varies widely. I think like the ambient scribes and the rev cycle solutions are probably the ones that I've heard, people talk about the most in the smaller provider space. And as well as things like prescriptive predictive analytics, like how to engage patients. But there are some folks who have no solutions or maybe are just at like a co-pilot level. And then there are folks who are really, really engaged and wanting to get started. And so I've spoken to many of the sort of PCA networks, going to the NAC workforce conference. Like we're really just trying to hear, like listen to where folks are at and what they need, and then be able to sort of help support them.
Yeah, it's such a difficult and strenuous work, right? I mean, especially at the smallest, we're trying to be super helpful to them, while at the largest, trying to bridge that scale gap. So one of the best ways for smaller organizations to get help from their larger brethren, as it were, is, and in general, whenever speaking to anybody, I really want to push audience members to ask for prompts. Like instead of asking for advice, you say, hey, what prompts did you use to answer question ABC, or how did you create your policy document? And one of the things that Chai and others will be doing over the coming years is playbooks are going to just be prompt playbooks, right? They're just prompts after prompts after prompts. And so if in the discussions that you're having with AI, nobody mentions the word prompt, you're losing, right? In every AI discussion that everyone should be having, it is, oh, I just did this with my EHR vendor. I prompted them for this, got this from the AI, got this policy, asked them these questions, et cetera, et cetera. And EHR is obviously they're playing some central role in a lot of hospitals and health systems. But as AI makes its way down the path, the EHRs will start to get less and less importance due to just a system of record. So you got to learn those existing systems on the AI side, like the ChatGPTs, the Anthropics, and those guys. So we've got another great question. Christine is asking, Merage, what are the key considerations for integrating AI tools into the EHR landscape while ensuring compliance with HIPAA, patient safety, and clinician usability? So it sounds like you guys are working some areas in there, but could use a lot of help from the community as well. So tell us.
I mean, this is really where I am not the expert, but I work with a lot of experts. And so keep an eye out. I mean, some of the answer is it depends on the AI solution, right? Are you talking about sort of a predictive risk tool? Are you talking about a Gen AI or sort of LLM-based solution? So I think some of the answer is it depends. And what we are doing to try to capture that it depends is really thinking about, okay, for developers and integrators and implementers, what are the best practices, or at least it's hard to say best practice nowadays because it's so new and ever changing. But what are the sort of industry agreed upon practices that we should start with for a particular solution? So we have testing and evaluation frameworks for like discharge note summarization and sepsis risk prediction models. That doesn't include sort of the sort of how do you implement piece, but our next sort of set of use cases like direct to consumer, general health advice chatbot, EHR info retrieval, clinical decision support solutions. We are starting to develop those sort of best practices and where do you start and where do you go, especially for tools like EHR info retrieval tools that are meant to communicate with and embed into EHR. So keep an eye out for those. We hope to wrap up the chatbot one by the end of this year, and then look out for like early next year for the clinical decision support and EHR info retrieval, and there'll be more use cases as well. So if there's anything that's of interest, feel free to reach out to us.
And Christine continued the question. She was asking, is there any specific guidance around sensitive data, PHI versus non-PHI?
Yeah, so you're gonna want to still stay aligned with HIPAA, but there are sort of like additional things here because the use of even de-identified data comes with risks, especially when it comes to AI. So I actually learned recently we announced a partnership with the Joint Commission, but the Joint Commission has a voluntary sort of responsible use of data certification that folks can do. That certification is specifically meant for the use of de-identified data in healthcare. And so there's some considerations that they've sort of outlined, and we will sort of start to bring forward when we add the sort of data management piece into our governance playbooks. But yeah, I think it's really important to make sure that you have audit rights when you're partnering with vendors that, or try to negotiate those. I know it's not easy. And also, make sure that the uses of the data are very clearly defined. When can it be used, when not? Prohibiting re-identification of data and being able to check and make sure that folks are not doing that on the vendor side. So there are those types of things. But if the data belongs to the EHR vendor, it's a little bit more tricky there. But if you're talking about external vendors, yeah, I would say that's sort of where to start.
Yeah, and just as an extension for Christine's question, the main thing to think about is that the regular business associate agreements all apply here. So in some respects, if your organization is allowing you to treat the AI as a cloud tool, it is then no different than a regular cloud tool based on rules, regulations, and business associate agreements, who's a covered entity, et cetera, et cetera. So try to see if you can get your organization to kind of pigeonhole that into a regular cloud service. If for some reason you cannot, then everything Merage said 100% applies to de-identified data, et cetera. But then you've got other choices. You've got, for example, there are developer tools that are able to run behind your firewall. So, if you're using Hugging Face or those kind of tools, you can run those behind your firewall, and then you get to use your own regulations for patient sensitivity, classified data, et cetera. But if you're not running it behind your firewalls and you're running it in the cloud, just use regular BAAs. And there are now special BAAs, which I believe, if I'm not mistaken, Microsoft is signing, AWS is signing. I believe ChatGPT, OpenAI started to sign them. I'm not sure about Anthropic's, but check with each one of those. And the EHR vendors are already speaking about this, so you can certainly ask them. But there is no hard and fast rule on identified data not being allowed. It's identified data is not allowed if the rest of the rules also don't allow it in your organization. Merage, do you generally agree with that, or any other comments on that? And you're on mute.
Yeah, I would say generally. And at CHI, we also certify assurance resource providers of various categories. One of them is we certify solutions that enable kind of responsible AI practices, one of them being privacy. So we just certified a Beekeeper AI, and they have a confidential compute sort of platform that allows for data to stay at the site, doesn't have to go anywhere, allows for the vendor or the developer of the solution to keep their proprietary information private, and then still allows for things like local validation of a model on data that doesn't necessarily need to be fully de-identified. Like it can be sort of HIPAA compliant, but not fully de-identified because that information doesn't go anywhere. So there are also these kinds of solutions that are out there.
Yeah, so no, great points. And the only one extra thing you guys should ask your vendors about when you are signing BAAs is in the past, you haven't actually had to worry too much about them taking your data and using it for their own training purposes. And in fact, this is one of the reasons that AI is slightly trickier to be able to use the data, not for regular use cases, but to use it for training. And then in theory, if it's being trained, let's say it's a multi-billion parameter model, the training data will get all merged with all the other data. And so in general, this is all being litigated. And you guys may have seen just this week, Anthropic has settled for a $1.5 billion suit for the use of copyright data. And these kind of lawsuits are really what the only way we're going to get answers is over the next 5 or 10 years, we're going to have lots more lawsuits. To prevent those, try to make sure you ask people in your BAA, yes, you are not using it for transactional use cases, but are you using it to train a model, which we will then share? The problem with asking that question is you don't know what to say when they give you the answer. Like if they say yes, what do you say versus if you say no? And that's the kind of question you can come back to Merage and the team at Chai about when it gets a little bit more detailed and all the nuances come in. As I like to say in almost all of our health impact discussions, in this area of AI, if somebody says they know the answer, canonically, they're either lying to you or they're delusional and you got problems, right? So nobody has the answers here, but we all have directions and we're kind of trying to build this community. And that's why it's so awesome to have Merage here talking about these things. So Alice asked the question about using federated learning. I'm not sure I completely got the question, but if that's enough of a trigger to answer anything, Merage, let us know about federated learning. Otherwise, I'll move to
I think maybe federated data sets is the potential question. So that, yeah, I think that is a possibility. There are pros and cons to that, and I encourage you to look at some of those. I think the data heterogeneity can be a big thing. What might work on sort of a large pool of data that is nationally representative may not actually generalize to site-specific context. So it's really important to have at least site representative data sets if possible. And we still encourage, like, even if you test a model on a federated data set, we still encourage local evaluation of some type, whether it's representative of your local sample or directly on local data, because generalizability is rough sometimes.
Excellent. In the last few minutes that we have, we know that on the responsible AI side, a lot of the equity work is focused on bias detection. Of course, super, super important. But some feel that bias detection is less important than just access to data. What is Chai doing for pushing shared equity, critical data sets, access to these kinds of AI tools? Tell us how you're doing about that challenge.
Yeah, this is a hard question because, population level, sometimes people sort of want to maximize performance for the majority of a sample or of a population rather than, reduce that sort of performance in order to get equivalent or similar performance across populations. I think one of the things that we're doing, like I said, certifying assurance resource providers, one of those subtypes being folks who have nationally representative data sets or access to nationally representative data sets that can sort of help validate solutions and do the bias evaluation and see, you know, how might this model perform on different subgroups. But the other piece is just because performance is different doesn't mean impact is different. And I think keeping those questions, that comes up more on the monitoring side. I think it's really important to not just prevent the use of a tool, but be transparent about what your tool can and can't do, what it has and hasn't been tested on, and then allow the person on the other end to develop the appropriate mitigation strategies for that. Maybe I need to monitor for this particular population that it hasn't been tested on. I mean, the examples that we do vaccines, we take vaccines even if they haven't been tested on every single population, but we also have this data that's ongoing and being collected to make sure that if something were to come up, we know how to intervene appropriately. So that's some of the work that we're doing. And of course, we're putting out bias metrics, methods on a use case specific level to help folks sort of evaluate these things.
Awesome. So in the last 2 minutes that we have left, as Carol brings on our next group, let's talk about the standards versus procurement speed. Standards development takes years. Obviously, like you said, you're going to have chat stuff done by the end of this year, but people are using it today. So how are you keeping Chai's work relevant to real-time buying cycles? And that'll be our concluding question that will take us to the next session. So what should executives prioritize while these standards evolve?
Yeah, I think at the very basic level, transparency, understanding what is happening, and and not just transparency for the users. I think that's sort of a misinformation. Sometimes they don't want that transparency, but transparency when it comes to when you're procuring that solution, asking those standard questions like something like a model card. So starting there, doing risk-based categorization and management of your solution. So really thinking about, okay, what is this being used on? Does it have direct impact on patient care versus indirect impact? We're not in we still use a consensus process, not as sort of detailed and in-depth as a lot of standards organizations do. But I think continuing to look at these documents as they come out, continuing to hear each other, listen to each other. I think these forums where people can get together and say, I'm doing this. We added this thing called Tales from the Trenches into our work groups, which are folks that are developing the solutions and testing these solutions and adopting them, coming together and saying, this is how I'm doing responsible AI in the context of this kind of a use case. And then people discuss, they're like, yeah, but I tried that and it didn't work, or and just joint learning. So I think that's the best we can do with this ever-changing landscape. And at Chai, all of our documents are living documents. Even our testing and evaluation lives on GitHub. People can submit issues if they find issues. So we try to stay on top of this as much as we can.
Awesome. And we really appreciate all your time here, Merage, today, especially you're going to be on stage to a bunch of other practices shortly. But just in a concluding way, what I'd love for everybody to think about is as you're sitting in your meetings and you come up with a question for Chai or others, obviously you're going to run it through ChatGPT or Claude or something to get your policy answers. It'd be great when you share it with the community and say, okay, here are the prompts that I used. Here's what I came up with. Please take this as input, because we had to make this decision this week. We can't wait for Chai, or we can't wait for standard body XYZ. That's okay. Make it transparent, make it collected, hand it over to your colleagues at Chai and say, here's how we used it. Here's how we're doing. Could you help us with a peer review? Help us with understanding whether or not you think we did the right thing. So there's lots and lots of ways of getting help, especially because you have really nice people like Merage leading the tasks over there at Chai. And with that, we're off to a great start. Our first session is over.
Yes, we are.
Thanks so
Absolutely.
much. I added some contact information in the chat. We also, for members, have a Discord channel. So there's a lot of spaces to learn. Feel free to reach out.